Hi, my name is Megan Kirchgessner and I'm the wildlife veterinarian for the Virginia Department of Wildlife Resources. I'm here today with a panel of DWR staff to discuss chronic wasting disease, what steps we're taking as an agency to manage the disease, and how you can help. Chronic wasting disease, or CWD, is a fatal disease that affects deer, moose, elk, and reindeer. It's caused by an infectious protein known as a prion, and it's been detected in 26 states. Virginia confirmed the first case of CWD in a wild white-tailed deer in 2009 in Frederick County. Since then, the department has closely monitored the disease in Northwest Virginia while also initiating various new harvest regulations to try to manage the disease in affected deer herds. We know there's a lot of confusion about the disease and the steps that DWR is taking to manage it, and we're here today to answer those questions both in this video and in the live Q&A in the comments section. Currently, there are 3 disease management areas in Virginia known as DMAs. DMA 1 includes Clark, Frederick, Shenandoah, and Warren counties. DMA 2, which is located just to the east of DMA 1, is composed of Culpeper, Fauquier, Loudoun, Madison, Orange, Page, and Rappahannock counties. The newest DMA, known as DMA 3, includes Floyd, Montgomery, and Pulaski counties. Please check out the DWR CWD website for additional information on each DMA, including 2 video presentations. We also have a 3rd video that covers the statewide perspective on CWD. Today we have various DWR staff members available to answer questions received by the public. Cale Godfrey is DWR's Assistant Wildlife Chief. Matt Knox is DWR's Deer Project Leader. Officer Brett Clausen is a Conservation Police Officer. And as previously stated, I am the department's Wildlife Veterinarian. Casey Maynard, DWR's Wildlife Disease Technician, will be our moderator for today's Q&A. Please check out the DWR CWD website for any additional information that you may seek after today's Q&A. Thanks so much for tuning in today.
Is there a quick field test for CWD that hunters can use to test their deer?
At this time, there's a lot of research going on at a variety of labs to develop a field test, but there is not one available right now.
How long does it take for test results to come back?
It typically takes about 2 to 3 weeks for us to receive results from the lab. As long as everything goes smoothly at the lab, we'll fall within this time frame. Occasionally there are some backups that may extend that length of time before we receive the results, but typically 2 to 3 weeks.
How can someone get a deer tested if it was harvested in a county not included in a disease management area?
Virginia has set up a cooperative system with the Virginia Department of Agriculture and Consumer Services. They have several labs located throughout Virginia, and for any deer that's harvested outside of a DMA can be brought to one of these labs, and for a $35 fee, the staff at the laboratory will collect the samples and submit them to the lab for testing.
What does voluntary CWD testing entail? How can I find out where the voluntary testing sites are located?
There's information on the DWR website that describes all of the locations in each one of the DMAs where a refrigerator has been set up for a hunter to drop off a deer for testing. A hunter simply needs to bring the deer head, 4 inches of neck, and follow the instructions at that refrigerator in order to get that deer tested for CWD at any point during the deer hunting season.
If you harvest a buck in the DMA and want to submit it for voluntary testing, can you cut off the antlers?
Absolutely. We actually encourage hunters to do that because it actually saves room in the refrigerator.
What do I do if I kill a buck in a mandatory sample county on the mandatory sample day and I want to bring it to a taxidermist and get it mounted?
We still request that these hunters stop by a DWR CWD sample station before heading to the taxidermist. When you arrive, make sure you say clearly and several times that you are taking that deer to a taxidermist. When staff hears you say that, they're not going to touch the deer, they're simply going to get information from you and then send you on your way to the taxidermist. Before you leave, we're actually going to collect your information, your name, your number, and also the name of the taxidermist where the deer ultimately will be. And then we'll try to follow up with the taxidermist a few weeks later and try to collect a sample after the deer has been caped out.
What is the relationship between Hunters for the Hungry and DWR? How does the discovery of CWD in a county impact the Hunters for the Hungry program?
Hunters for the Hungry and DWR are actually two discrete entities. We work very closely together, but we are separate. We do, however, facilitate Hunters for the Hungry when CWD testing is required. The Virginia Department of Health has recommended that any deer that's harvested in a CWD positive county that's going to be donated needs to be tested for CWD prior to entering the food chain. So we work with Hunters for the Hungry to ensure that these deer are tested, those test results are received before those deer are actually donated back to the community.
Matt, what are the new harvest regulations within the disease focus zone?
That's a very good question, and there are multiple changes in the disease focus zone. I'm going to start with one that's not in the disease focus zone, but in that three-county area, Montgomery, Pulaski, and Floyd, and in Montgomery and Pulaski, the fawns deer season has been extended to 2 to 4 weeks. County, on private lands only, in Montgomery and Pulaski, Floyd already had a 4-week deer season, so now they have a 4-week deer season, but those are county-wide regulations. Within the disease focus zone specifically, there are 3 changes that people need to be aware of. The first one is we have added a September antlerless only firearms deer season, and it's only in the designated disease focus area. That disease focus area is about a 40 square mile area designated by 81, Reiner Road or Highway, and the Little River. And that 40 square mile area in there has 3 special seasons. The early September antlerless only deer season. Second, on the back end of deer season, it has a January, February, and March late antlerless only deer season. So those are sort of like the bookends on the normal deer season. And within the normal deer season, we have started a pilot program, which we're calling the disease focus program. What we have done is we have gone in there and identified all the landowners that had more than 5 acres, and we have issued them additional tags. Those tags will be good between, first Saturday in October and the first Saturday in January. It allows them to take deer in addition, either sex deer, bucks or does, in addition to the bag limits within the county. So countywide in Montgomery and Pulaski, there's a change from 2 to 4 weeks on private land for farms. And then within that smaller disease focus area, only in Montgomery County, that 40 square mile area, there's an early antlerless only season in September, there's a late antlerless only season in January, February, March, and then during the normal deer season, there's these CWD management tags.
In regards to those CWD management tags, how do I check in a deer killed off a CWD management tag?
Again, those tags were mailed out to landowners. I think we mailed out about 1,100 tags to about 470 landowners, as I recall. They just come on a sheet of paper, a tag per sheet of paper. When they kill a deer, they'll have a tag. The hunter has to have a tag on his person when he's out there hunting, him or her. And when they're hunting, and so when they kill a deer, they'll have to notch the tag. Then they'll have to check it, but there's only 2 methods they can check it by. They can check it by internet or by telephone. The reason I say this is they cannot use what people call the e-notch system that's on the mobile app. Now you can use the mobile app because the mobile app actually has an internet option. So you can use the mobile app, the internet option, but you can't use the mobile app and the e-notch option, or you can use the telephone. So we have 3 ways to check deer this year in Virginia, all electronic, and a CWD management tag can only be checked with 2 of those 3.
Cale, how high of a priority is CWD at DWR?
CWD is a very high priority for the Department of Wildlife Resources. It's one of those topics that often comes up at our board meetings. We have a lot of staff time that's devoted to CWD management, thinking about CWD and our philosophy for management and our approach to how we want to address the expansion and spread of CWD across the state. And we devote a number of resources to it as well in terms of our financial resources. It's one of the higher priced budget items that you'll find within our budget. So in terms of just conversations, the level of conversation within the department, it's at a very high level. We devote a lot of staff time and we devote a lot of financial resources to it as well. So a very high priority for the Department of Wildlife Resources.
Speaking of financials, where does the money come from to manage CWD? Is it from the DWR budget?
Yes, the money comes from our budget for the most part. We do actually apply for some grant funds that are out there, and over the last couple of years we've received a couple $100,000 in grant funds. However, that's only a portion of the monies that are budgeted within, for our CWD management within the Commonwealth. All of that money does come through our budget, and that is generally brought to us from revenues for hunting license sales, as well as some sales tax that goes on sporting equipments and wildlife viewing equipment that are out there as well. So the money does come from the department's budget directly, and we try to do the best that we can to find other sources of grant monies out there as well to help us do what we need to do to address CWD.
If I kill a deer infected with CWD, will I be able to get my tag back or another tag?
Very simply, no. If you kill a deer that happens to have CWD, to be infected with CWD, then you will not get another tag.
Is DWR considering a statewide deer feeding ban?
Well, it's certainly one of those topics that receives a lot of conversation internally among staffs in our administration. If you look at our current statewide deer feeding prohibitions, you will notice that they cover almost 1/3 of the entire Commonwealth at this point in time. And at some point in time, as CWD expands, it will continue to have broader coverage across the Commonwealth. And as it does that, it's certainly one of the things that we think about. At what point in time do we need to pull the trigger and say, okay, here we are going to move into a statewide feeding ban because we feel that is a very necessary thing to address chronic wasting disease for us. The other thing that we're also beginning to see is some public comments to us about, maybe it's time to start thinking about a statewide feeding ban. So we've had comments at our board meetings over probably the past 1.5 to 2 years of some individuals that are thinking that, yes, this is probably, even from a public perspective, what we need to do to address the spread of chronic wasting disease in the Commonwealth.
Can DWR regulate the sale of corn, minerals, natural deer lures and scents, etc. at local stores?
Unfortunately, DWR doesn't have the authority to dictate or mandate commerce activities within the Commonwealth. It's something that we get questioned on quite frequently because of the plethora of products that are out there in stores, particularly in the fall during that time of year when the hunters are thinking about going into the woods and pursuing deer. But it's not something that we have the authority to actually regulate and manage within the Commonwealth. So our approach to that is the best outreach and communications that we can do regarding the legality of feeding deer in certain parts of the state and during certain times of the year, as well as the use of some of those scent products that are out there.
Are the early and late seasons in DMA 1 on national forest lands or private only?
Yeah, the 2 seasons I mentioned earlier, the early season is what I call a September season, antlerless only gun season, and then the late January, February, March is an antlerless only gun season. They are only in effect on private lands. They do not take effect on the National Forest in Pulaski or the National Forest in Montgomery counties. Private lands only.
Will the early season be bad for deer populations due to the harvest of does who are still nursing fawns?
No would be the most accurate answer. Now, we've always said our deer seasons to never begin before the first Saturday in September. And the reason for that is by that time, the overwhelming majority of fawns are weaned and will survive if they're orphaned. So that's why we set that date. Now, is it perfect 100%? Probably not, but the vast majority of fawns have been weaned, and if they're orphaned by a hunter in September, somebody shoots the mother and the fawn or fawns, multiple fawns are there, they will survive. Most likely they will survive, high probability. So it will not be bad for fawns.
Will a significant number of shed bucks be harvested in late seasons in DMA 1 and the DFZ?
No, it's a big concern of deer hunters whenever we talk about this late season, because again, that late season is 3 months long. It's antlerless deer only, and bucks have started shedding in December, so there are a lot, in fact, most of the bucks will be shed by the end of that season, but what we have found is not a large number of shed bucks are killed during that late antlerless only season. The only thing I can attribute to that too is deer hunters are selecting to not shoot shed bucks. They're identifying what they are. And of course, it's not, they look like does, but if you look closer with binoculars or something, you can distinguish a shed buck from an adult doe deer.
Can other animals be infected by CWD?
At this time, research shows that the only animals that are susceptible to CWD are members of the family Cervidae, which include deer, elk, reindeer, and moose. However, pigs possibly could be susceptible to CWD. Experimental research has shown that potentially pigs can become infected with CWD when experimentally exposed. Natural infection or infection that occurs when feral pigs are overlapping range with infected white-tailed deer or elk has not been proven, so pigs are in the questionable category.
Can humans eat meat from a CWD positive deer?
At this time, it does not appear that humans are susceptible to CWD. However, there are other related diseases that are able to infect humans. Therefore, every year, millions of dollars worth of research is conducted investigating this exact question. The CDC and the DWR does not recommend that any human consume meat collected from a CWD positive animal. The CDC also recommends that hunters get their deer tested for CWD if they are hunting in an area known to be affected by the disease.
How do you kill a prion? Are prions neutralized by cooking?
Prions are very, very hardy. Research shows that they can survive years, potentially up to 16 years after being deposited in the environment by an infected deer. Unfortunately, it takes temperatures of about 1,400 to 1,800 degrees Fahrenheit for about 10 minutes before prions are deactivated. So certainly cooking is not going to be effective at killing the prion.
Has there been any discussion about increasing the number of tags given to hunters throughout a DMA?
The short answer would be no, but I need to define that a little bit more in detail because we have started this pilot program called a disease focus zone. A DMA is a group of counties that are near a positive or a group of positives. But for instance, we'll talk about DMA 3, which is down in Southwest Virginia around Blacksburg now, because we found a positive deer in Montgomery County. We have a 3-county DMA. We have not talked about increasing the number of tags there, but what we've done is gone down with a pilot project in that 40 square mile area that we're calling a disease focus zone, and we have issued a lot more tags in that defined area. So have we talked about doing it on a DMA perspective? No. Are we talking about doing it on a disease focus zone perspective within the DMA? Yes.
How did CWD get to Montgomery County? What is the status of the disease in the Montgomery County deer herd?
At this time, all I can report is that DWR tested one single CWD positive deer that was harvested in Montgomery County in 2020. We simply do not have enough data right now to make any conclusions about where the disease came from or what the status of the disease is in the Montgomery County deer population. Science shows that we need to have at least probably 3 years worth of intensive monitoring before we're going to have tested enough deer to be able to draw conclusions about the status of this disease.
What will the department do if no additional CWD positive deer are found in DMA 3?
DWR uses an internal document, the DWR CWD Management Plan, to guide our response to new detections in a new area and also to help with a continuing response in an area where the disease has become established or it's been around for several years. This guide dictates that DWR is committed to testing deer very heavily in a newly infected area for at least 3 years. If no additional positives are confirmed after 3 years of intensive monitoring, we have the option of continuing to test or discontinuing monitoring and dissolving the DMA at that time. The plan also dictates that if we have found no additional detections after 5 years of intensive monitoring, then DWR will dissolve that DMA.
Are food plots allowed due to the year-round feeding ban? And what impacts do food plots have on the spread of CWD?
Food plots are allowed. Statewide, counties that are not in DMAs and counties in DMAs. So food plots are allowed. Now putting corn or a substance on the ground to attract deer is not allowed, feeding or baiting. But food plots are not covered. Because if you think about it, a food plot's just a small oat, farmers plant oat fields all over Western Virginia. A food plot's just a small oat field, so it's really the same as a farmer's field, just on a smaller land scale. And also, if you think about it, one of the reasons are we concerned about food plots? Theoretically, you could say yes, but food plots are not nearly as risky to us as a bait pile. Because think about a bait pile. People pour corn on the ground. It's illegal statewide during deer season. Illegal during all seasons for hunting. And that area might be 10 by 10 feet. That's 100 square feet, just pile of corn. An acre is 43,560 feet. So putting a pile of corn on the ground concentrates deer 436 more times than a 1 acre food plot. So can food plots concentrate deer? Obviously they can. Do they concentrate deer to the same level as bait piles? Nowhere in the ballpark. And of course, like I say, a food plot's just an agricultural field, and we can't outlaw, and of course we're not even thinking about it, but you can't outlaw agricultural fields. So no, we're not terribly concerned about food plots at this point. We are very concerned about bait piles.
What can landowners do to help with CWD management?
Well, one of the biggest things that landowners can do to help with CWD management is simply to learn about CWD, what it is and how it impacts our deer resource in the Commonwealth. That will go a long way just to helping people understand what are some of the things that they're doing that could potentially be contributing to the spread of chronic wasting disease, and what things they might be able to do that would help to mitigate the spread of chronic wasting disease. But one of the biggest things that they can probably do is really consider and look at allowing hunters onto their property to remove deer and manage the deer population at an appropriate level so that we can minimize the interaction of deer on the landscape out there, because this is really a disease that is spread through deer-to-deer interactions. Lower deer populations and certain management activities tend to reduce those deer-to-deer interactions, and whatever landowners can do to help lower deer populations and minimize those interactions are very positive things for us in the fight against CWD.
Do lease companies have a responsibility to inform hunters that they are hunting in a DMA and need to follow all the laws relative to managing CWD?
It would be great if lease companies would be informing their leasees about the presence of chronic wasting disease in certain portions of the state. However, it's really the individual hunter's responsibility to know the laws and the regulations that pertain to them and the things that they need to do, and really to educate themselves about chronic wasting disease and what the department is trying to do to address it. So it'll take a village, so to speak, in order for all of us to work together to fight chronic wasting disease in the state. But ultimately, the responsibility lies with the hunter to be educated and know what the laws and regulations are and the things that they can do. But whoever can help and assist in that is also great as well.
How certain are you that the DMA3 CWD positive deer was from Montgomery County?
Very certain. DWR did a fantastic job at checking all the boxes and investigating the claim when it first came in. They determined that it was killed in Montgomery County using time-stamped photographs, geographic features on the specific location, the property where it was killed, plus DNA testing afterwards to determine that it was CWD positive, killed in Montgomery County.
How do you know if a deer harvested during the early or late antlerless only seasons was actually killed in the disease focus zone as opposed to somewhere else within Montgomery County?
It boils down to integrity and properly checking in the deer when you kill it.
Does DWR regulate processors or taxidermists?
Yes, DWR regulates taxidermists, but they do not regulate processors, and we do that through a permitting system.
How can I help to increase hunting opportunities and access to properties in the disease focus zone?
I think that's another very challenging issue for us because we do have a number of areas in the Commonwealth that serve as refugia where hunting is limited and opportunities to manage the deer population and reduce the deer population to levels that help to minimize the spread of chronic wasting disease is a big challenge. But one of the things that you can do is help educate landowners and others who are out there about chronic wasting disease, what it is and what it isn't, what are the management activities that can be done to help address it and slow the spread of chronic wasting disease. So educating yourself and in turn educating others, and in particular those individual landowners or those areas where hunting may be limited or may be prohibited currently, to open up some hunting and allow some hunting there would be great opportunities for us in terms of addressing chronic wasting disease in the state.
How does Earn a Buck work in terms of order of harvest in or between counties?
Earn a Buck only operates within a county. You know, what you do in County X only matters in County X. So to give you an example, let's say you're in Montgomery County. What Earn a Buck says is before you could take a second antler deer on private land, you'd have to take at least one antlerless deer on private land in Montgomery County. But you could kill a buck on private land in Montgomery County, drive over the next day and kill a buck on private land in Floyd County and be legal. So the deer do not move from county to county. Earn a Buck is defined, each unit is the county. And in the cases of DMA 3, a lot of the counties in the state, it's just private lands in that county. I could go with a 2 deer a day limit in Montgomery County, I could go kill a buck on private land in the morning, go hunt the national forest and kill a buck that same day, kill 2 bucks in a row, and I'd still be legal. So it's defined by county, and in a lot of counties it's just defined to private lands within those counties. Again, go to our website, we've got some questions and answers, and read it literally, I mean, because that's the way we've written it.
Why is transport and disposal of a carcass to a landfill the best option?
Because a landfill is lined, it's the best option we have to keep prions contained and to avoid environmental contamination.
How will I find out if my deer tested positive for CWD?
DWR staff will call any hunter that harvests a CWD positive deer immediately after receiving the test results. During that conversation, DWR staff will recommend to the hunter that he or she not consume that deer, that he or she double bag that venison and transport it to a landfill for proper disposal.
If the taxidermist I prefer is outside of the DMA in which I hunt, what should I do?
Legally, you'll need to cape out that deer and remove any brain tissue before that deer head can legally be transported out of the DMA to your taxidermist of choice located in a non-DMA county.
Can entrails be left in the woods when field dressing a deer within a DMA?
Fortunately, not all parts are created equal when considering the distribution of prions. There's no organs that are normally removed during the field dressing process that are highly concentrated or really full of prions. Therefore, it's a low-risk maneuver to leave field-dressed organs in the field as close to the point of harvest as possible.
Once my deer sample is collected, how will I be able to check my results?
Results are typically received from the lab within 2 to 3 weeks after submission. Any hunter that has harvested a CWD positive deer will receive a call from DWR staff immediately after those test results are received. For hunters that do not harvest a CWD positive deer, these individuals may check the results of their deer on the DWR CWD website. You only need to enter your phone number and the initials, and you can view your test results. If you are hunting in a disease management area, we want you to keep hunting. All of our both management and surveillance efforts are dependent on hunter buy-in, participation, and assistance. So we need you to keep hunting, but we want you to comply with those CDC recommendations and get those deer tested. Please make sure that you are not moving whole carcasses or high-risk carcass parts illegally out of a DMA. Do your best to properly dispose of any deer, harvest it in a DMA, in a landfill, if at all possible. Make sure you pick up your deer feed and your mineral lick so that we're not congregating deer around an attractant that's going to lead to increased contact between infected and healthy deer. Natural deer urines and attractants are illegal across the state of Virginia. And please, if you see any deer that potentially may have CWD, meaning they're exhibiting the combination of neurological and wasting signs, please go ahead and give us a call at the Wildlife Conflict Helpline and we'll get you in touch with a local biologist to assess the situation. And lastly, all of DWR's surveillance, monitoring, and management actions are dependent on hunter buy-in, participation, and cooperation. So I'd like to extend a big thank you for all of the help that I know we're going to receive this coming season. Thanks again for tuning in today and taking part in this Q&A panel. If you have any additional questions, please check out the DWR CWD website.